going. So I have Justice Court here. All right, I'm going to call the February meeting for the Criminal Justice Coordinating Council together into session. Madam Clerk, are we in compliance with open meeting law?
Meeting notice has been sent.
Can you do a roll call?
James Slender,
Present.
Lorraine Gouget,
Not present.
Mark Howard.
Here.
Tom Hall,
Here.
Kathy McCoy.
Not present.
She is actually online.
Oh, Kathy, can you hear us?
I think she's having some trouble with her mic.
Doug Rotek.
Here.
Bruce Paquette. Ryan Reed. Jeff Schley. Tweet Schuman. John Yackel.
Present. All right, let the record reflect we do have a quorum. Please rise for the pledge of allegiance.
Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Meeting agenda has been presented. Is there any committee members here with questions about the agenda? Hearing no questions, moving on to public comment. We have people from the community, and I want to make sure that you got to tell her your name. I don't think Vince, say your name. Tell her you're Vince. Tell Lynn who you are.
I'm Vince Curry. I'm assistant for Bruce. I'm assistant DA.
Could you spell your last name?
KURTA.
And then we'll find you a chair somewhere. So I'm gonna open the floor up for public comment. Public comment is intended for those people who are here, who's not on the agenda, who wish to address the committee. I want people to know that you have 3 minutes. In that 3 minutes, you can address the committee in whatever matter that you wanted to address them. The committee will be instructed not to respond because that public comment is your opportunity to address the committee. And then from there, if you want something to be resolved, we can get that to the bottom part of the agenda. So if you're asking for feedback, you probably won't get too much, and I don't want you to be frustrated by that. There's just another mechanism for that kind of involvement. So with that being said, raise your hand if you're a member of the public that want to address. Your name?
James Carr Roll.
What is it?
James Carr Roll.
Anybody else from the community that wishes to, anybody here from the public who wishes to address the committee? Jason, did you want to address the committee?
Yeah.
Yeah. Any of your group want to address the committee?
Oh, yeah. No? Oh, okay, yeah, all right. Yeah, we'll be together
Anybody else who's not on the agenda who wishes to address the committee? Do anybody online who wishes to address it? Anybody who you don't recognize?
Nope.
Anybody with their hand raised?
Nope.
PJ, you get to go first. You got 3 minutes.
James Carr Roll, born and raised in Wisconsin. Here today to talk about digital programming for the citizens. As you can see here on the TV, I got my neighbor, who's my prop. Bar prop, question why DLC? When does Mind Television, or why does Mind Television Programming have the DLC initializing the programming of the television I bought and or borrowed from the neighbor? I was released from the state's custody September of 2019. I was not ordered to a transition house or any other counsel that the state provides. Though I did question my lawyer about the terms of release and the available opportunities for transition. Unfortunately, my lawyer did not provide these answers I needed that day. Otherwise, my transition from conviction would have been different. I would have possibly stayed within the city of Salt Lake where I would have been closer to my daughter. This did not happen. I went to my uncle's house after I left jail and was released and fell asleep on his porch. And then I woke to the Washington County Police advising me that my uncle said I could not stay there. My mother was called and I was transported to the American Inn within the city of Hayward. I have since been living within the city limits of Hayward since my release. I have during this time been
Got it incoming.
and also mental health assessment and testimony. And also the prescription Lomax that was prescribed to me by the doctors at Essentia, Dr. Tonkin and Dr. Malcolm, who both had lied to me that day and told me when I had asked them if it was an alpha blocker, and they said no. In reference to an alpha blocker, I'm speaking of the cerebral response within the human mind, cortex, memory, nerve. Since then, as I have had these problems, but as I've been healing, thankfully, I can say to you all, I am healing, thankfully. As I've had problems within my heart and muscle and nerves within my body, the area of my skull is one of them. These areas, the areas within my body, fine, it has been a concern of mine. I have damage.
James, you got 30
I
seconds.
know, I'm trying to go fast as I can, it's not really fair. I have damage to the cerebral stem and the muscle and nerve within my cerebral stem and within my mind because of what has happened. Now, my question for the criminal justice, and I know you said you can't respond, but I would like to be asked or answered. Am I, Timothy James Colorado, currently serving a conviction within the state of Wisconsin? And we know that I've known you since I was this big. Am I currently convicted?
So he can't answer that, and I'm not gonna have that, and you're about 5 seconds away from being done, so there's one of
Well,
that
then I
things up.
would ask why the DOC is in programs by TV in my apartment if I'm not within conviction, because that's illegal. You have
Well,
to
I'm
go
gonna
through
tell you
court
that
order. I've been in
the
court
committee
for
doesn't have the
15 years.
jurisdiction over that, so
Well,
I
why
wanna
is
thank
it
you for your
in program?
presentation, and that concludes your comments to the committee.
You're using an internet in a programming within the internet, within the community, I believe is unsafe. Do you believe in human interface? Do you believe in radio transmitters? that
Wow.
you can plant it?
We're about to go to human interface. Jason, you have the
Really?
floor.
Well, I'll take Christianity. Thank you. Okay.
Jason,
Okay, yeah, I'm Jason Fleming from the Elk Hill Tribe, born and Hewers. Mark and I are working on a couple projects right now. We'll be getting a healing house going on the tribe. I think we have the cranberry mark, we're not sure yet, we'll look at that today, but then we'll have a school system, be going with the cat company. So with this, we'd like to get in with the jail system here, work with the Huber inmates itself. Set up some programs, work with some programs, also working with the men and women's shelter. And I think I was informed that come here, present, and then be on to the next agenda. Is that how it goes? Okay, yeah, and hopefully we'll kick off that healing house soon. We'll be working with a lot of people in the communities. And also forming a community with the tribe. So working with the community centers are turning, like the elderly centers and the community centers. So hopefully we kick off a lot of things with that. Because we're going after the drug epidemic. Now we got the virus up there. So the more we get at it, and a couple more. So if you don't mind, Mark might want to say, want to get forward?
I wasn't really ready for this, but I work for Magnolia Ranch Recovery in Tennessee, as you consider. You know, I understand the struggles and the barriers, you know, that one has to go through, like, 12 years off the alcohol and 7 years off the meth and opiates and everything. And, I understand the struggles and barriers, listening to this guy and hearing the struggles and hearing the barriers. Having a place, a community place where people can come and get some of that support, on the way to go, open up some more doors. Treatment's one side, incarceration's another side. Getting out, actually learning how to live all over again and changing everything about what you've been living most of your life as a criminal, and an addict and some of that stuff comes from that. Having a place where they can count on someone being there for them to help them through a lot of these struggles, barriers, lives, learn how to accept help, learn how to ask for help, and learn how to stand up for themselves. Actually getting to this level where he's talking about getting some training, getting some schooling, getting some education behind, do some generational changes in the community to help out.
but Jason, I'm gonna put you on the agenda. So if you can stay out, we'll get you, if you want to stay for the meeting, it's for another 40 minutes, we'll be done. If not, come find me at the college and then we'll have a conversation about this, all right?
Because yeah, Becky wants to be part of this too, and Lorraine got the heads up too. So.
Yep. So I'll put you on the agenda for next month. So that concludes public comments. Has the committee had a chance to review the minutes from last month's meeting?
I'll make a motion to approve.
I have a motion from Mr. Lieutenant Johnson.
Second.
I have a second from Judge Yackel. In discussion, is there any discussion about the motion to approve the minutes as presented? Hearing no discussion, call for a vote. All in favor indicate by saying aye.
Aye.
Motion carries. Moving on now to item number 7, second courtroom addition design review, discussion only. Mr. Hoff, I'll give you a little bit more than 3 minutes.
Excellent. Thank you. Good afternoon. Can you hear me okay? Thursday evening, we have on the agenda, the county board agenda, an item for approval of funding for the second courtroom. I previously sent out, you should have it in your email, I just sent it out a little while ago, the presentation that I'll put forward at that county board meeting. Just kind of walking through the steps that the county board and the county has taken in preparation of receiving a Second Circuit Court in Sawyer County. It's been a long process. We've got some board members that haven't been around for the entire process. So I think it's important that we, make sure that they understand exactly what this means for the county and the importance of the decision that they have on Thursday evening regarding the funding. We've had several other discussions with the architect and the planning. Jeff Johnson and Sheriff Morotek have been instrumental in finalizing some of the intricacies of the planned courthouse and courtrooms and how they come together to alleviate some of the security concerns that we've had with the existing building and building a second courtroom. At the Thursday meeting, we'll have all of the experts in attendance as well, so the board will be able to ask any questions of anyone. Judge Yackel will be there, District Court Administrator Chris Channing will be there. I believe Chief Judge Boyle will be available. John Kane, the architect, will be available to answer any of those questions related to why we're even contemplating building the second courtroom. So once we get those questions answered, the main thing on the agenda for Thursday is the approval of issuing debt for the construction of that courtroom. Because it is issuing debt, the board is required to pass that by a 3/4 vote of the existing members. So we need at least 12 votes out of the 15 in order to continue on with the project. I guess that's what I had for now. If you've got questions or comments, especially related to what we need to talk about Thursday evening, I think that would be appropriate to kind of talk about as well. So I'll kind of turn it back to the chair.
Is there any questions from the committee regarding the discussion of the courthouse addition? I have 2 questions for you, Mr. Hoff. First off, does the construction that is being proposed, is there a possibility that the veteran services would be relocated in the new construction once the construction is complete?
We did have a lot of discussion about that, and part of the discussion centered around the building that the vet services are currently housed out of. It's an older building that's got some maintenance issues. So one of the things we asked the architect was, if we eliminated that building, maybe made more parking there, would we within the plans, because the plans are not only for the courtroom, but we also looked at the space for other court functions, the clerk of court, the DA, some of the other functions down that hall, especially the justice point or the, criminal justice activity that is also housed in that hall. And so it's not just a courtroom that's being contemplated within the construction plans, but what else is available. So, we did have some discussion about, if the vets were not in that building, where would they be? I don't see them in the new construction, but maybe within the existing wing, or, we would find maybe another building in existence, within the county to house that activity, or we could just leave them where they are. You know, it's not imperative that we move them out of that facility. It's just something we looked at as long as we were, you know, doing different things with that area. So not imperative that we do it again. They would not be in the new construction, but they could be in the courthouse or some other facility if that was better for them and for the long-term maintenance of the buildings.
It's indicated that Veteran Services could benefit from the addition or the construction for the courthouse building, correct?
Say again?
The veterans would benefit from the construction, correct?
Yes.
And then the second question, actually, and now it's gone into three. The second question is, there's a safety concern with the way that the construction is going to be constructed. There's a safety issue that will be addressed with the completion of the construction regarding inmates coming to and from the jail. That's contemplated within this construction, right?
Absolutely. That's one of the main things, and perhaps the sheriff or Mr. Johnson could address that. Can you see the layout that's on the screen as well that kind of addresses that 3 points of or separation of the three entities, the public, the court, and the inmates, and just the traffic flow throughout the new construction and how it's benefited not only within the building, but eliminating the need to cross the street with inmates and staff as well. So I'll turn it over to the sheriff for other comments there.
Let me preface this with Lieutenant Johnson is here, and I've asked Lieutenant Johnson to assemble some footage of an altercation that had happened in the courtroom that required the removal of a defendant who became unsafe for the environment, for both the courtroom, the court lobby, and as well as the outside. And it was, to my information, I haven't seen the video, but it involved 6 deputies to ensure that the area was safe and that it was a prolonged process. I say that because Lieutenant has that, and Tom, I want a space on the agenda for that video to be made available. So, the floor is yours.
All right, thank you, Mr. Chair. I did forget to bring that DVD over, but I can get it to you here as soon as we're done. If you look toward the top of what you're seeing on the screen, the three, there's a little white area, and then to the right of it, there's, you know, like kind of an orangish and then purple area there. That the white area, the orange and purple is the current Sheriff's Department building. The white area is the carport where the sheriff and chief deputy and I park right now. We're looking at adding holding cells, and that purple line that comes down the far right to be a secure hallway from the jail to escort inmates. Any of that purple area that you see around the top, down along the left, and then kind of is basically like a upside down L almost, down getting into the other courtroom, that would be inmate, law enforcement, and key card access only, which means the public would not have access to inmates as they currently do when we're crossing the street. The only time the inmate would be viewable to anybody in the public would be in the actual courtroom itself. That way there's that separation. The yellow areas are the courtrooms. The biggest change to the existing courtroom, the bottom courtroom on there is the current courtroom, but what would end up happening is that whole area in the reconstruction would be, in a sense, flipped upside down because the original plans had the existing courtroom not being touched, which meant that there really wasn't a way for us to be able to, I guess, from a security standpoint, get if a deputy is needed in one courtroom but they're in the other, there was no quick way to get from one to the other. This way it puts the entrances to both courtrooms across a small public waiting area. It minimizes public area in the building, which is a huge benefit to the safety concern.
But you'll make that video and then probably get the copy of that DVD or the video to Mr. Hoff so he can have that and coordinate with IT staff. And so, just to be clear, so I have a record of this, Mr. Lieutenant, if there is no construction, then the safety protocols would remain in place as they exist right now.
That is correct.
And so that there's any other further altercations with defendants who become unruly or become unsafe, the method that would be on that videotape is the method and how they would be dealt with in the future.
That is correct, and it, on the tape that you guys will see, it was August. It was nice and warm out. If that had happened on a day where, you know, the roads are icy, it's snowing, that's even worse of a safety concern.
So I can probably expect you to see you on Thursday night to kind of provide that illustration. All right, the last one, Mr. Hoff, is concern with the drug epidemic that we have. Is there contemplated within the construction the ability to provide services for people who are either using meth or withdrawing from meth, or providing like a meth clinic?
There's nothing for a meth clinic per se, but the drug problem obviously is attempting to be looked at and addressed by our criminal justice, this group right here, as well as the Justice Point folks. So we did meet with the Justice Point representatives that are in the building now, and just kind of got some ideas on what to plan for space needs that they would have for any future programming. So that's contemplated within the construction within that wing, or the remodeling actually within the current wing.
So it's my understanding though, right, that Justice Point was hired, and then Nick can speak to this when you get Justice Point a crack at this, is that we're working on grants to either do infrastructure or other types of services that would address people who are either in the justice system who have been either got meth or other drug or other mental health related issues, correct, Mr. Hoff?
Yes, and I think what we've been working towards and pointing towards is the TAD funding, grant funding for some of these programs, and I think either Mr. Channing or Justice Point can help address what that is, what that means. We do need to have a functioning drug court to be considered for a Second Circuit court. So those programming aspects, that we've been looking towards to develop is part of that. So I'll let you speak to that more eloquently.
You being me or?
Justice Point or Mr. Channing?
Justice Point will get their shot at addressing that here in a little bit. I just want to wrap up the second courtroom. So Mr. Houghton, if we are unable to put some kind of meth type of programming into this construction, we still have other resources that we're devoting to that going forward, regardless of this construction, correct?
Yes.
Is there anybody, Judge Yackel?
I guess I would just like to, I've been informed that there might be some concern with some board members that are pushing for some type of and a meth clinic is kind of a generic term because we have just as big of a heroin problem around here as we have a meth problem. But I think the answer to that is, in addition to what Tom has said and Justice Point is here, is that in getting the second courtroom and being awarded the second judge through the state legislature, is that what you're now are doing is any type of drug court whatsoever is incredibly time intensive. And with the caseload on a one branch system right now, it is overwhelming, and we're not able to have a functioning drug court. What you're getting with the addition here and with the second court from the state legislature is that you are increasing a tremendous amount of judicial resources and time that will be imperative into going into a drug court, in addition with Justice Point and helping to address some of the meth and heroin problems. Maybe down the road, the next step is some type of inpatient treatment facility or something like that. But right now, we need to get some of the basics in place, and that judicial time is incredibly important. I think we'll go a long way to. I think what it is, it's asking the same thing, and you're getting it. It's just called something different. You're getting it through Justice Point. You're getting it through an additional branch in the circuit court system, and you're starting to address those drug issues that we've desperately needed for a long time. Thank you.
Mr. Chair, may I interject?
No, you have the floor.
Okay, I believe the judge just mentioned the Justice Point, and that we're going to be getting some sort of programming through them. Will they be doing some sort of I guess like you said, meth clinic is kind of a general verbiage, but so that these people so they have somewhere in the area to go to, instead of having to go to, say, Eau Claire, Ashland, Superior. If they knew that they had somewhere to go in the area, maybe they would actually attempt to go to it when they know that they, instead of having to go to these other locations, unless, like I say, the Justice Point is going to be doing something like this, I think we really have to think about it, because this could be the only time that we may have or opportunity to build such a thing. Because you know how everybody knows how funding is, and just a thought, if the veterans came into the reconstruction area, and we could possibly use that facility. Thank you for your time.
All right, so before I have Justice Point respond, Justice Point's got a whole item on the agenda. Mr. Hellwig, I just want to make sure that we address your concern regarding the construction and the commitment of this committee to work forward even beyond the idea of what this construction should be. I'd like to restrain the questions to the second courtroom discussion. We'll go into Justice Point here just as soon as we conclude that. So is there any other questions that Mr. Hoff or the board can handle, can address regarding the second courtroom addition? I got the hands up in the virtual world. All right, we're going to move on now from number 7 to number 8, Criminal Justice Coordinator. Nick, you've got a few questions that you can probably address for Mr. Hellwig right off jump, but I know that you're here also to introduce your staff. Your staff has volunteered to sing a song of some sort, so we're ready to hear that anytime that you're ready to go, and the floor is yours, Mr. Singer.
Thank you very much, Chair. So yes, to start off, I'd just like to address maybe some of the questions that were raised about direction and opportunities for funding specific treatment services, whether that falls under the Mass Clinic, as the judge said, others.
Move one of those mics closer to you so that people can hear you.
Sure. So as I was saying, whether that will address the Mass Clinic or some other treatment services, I think it will. I think what Mr. Hoff mentioned earlier about focusing on specifically getting prepared for treatment alternatives and diversion grant is a key element of putting these puzzle pieces together. TAD funding can be used for treatment services and has been used for clinical services as well as medicated assisted treatment in the past. I can't guarantee that we'll make that in this grant cycle, but the grant will be released most likely in August or September, so we have some time to plan and be prepared to put a good proposal and put a good step forward on behalf of Sawyer County. So I think there's options. I think it's really important to have these conversations ahead of the time. You don't want to have these conversations once the grant has been released, because we'll only have 4 to 6 weeks to turn it around. So any direction or guidance or suggestions or you know, anything that the CJCC can give us, the more the better, because that's going to be some of the conversations that we have to have with clients.
Well, you have Mr. Hellwig's question, so if there's a way that you can address that, Mr. Hellwig, we have Justice Point now on the floor. If you want to address the other concerns that you have, including the commitment of the committee going forward in addressing these issues, this is your opportunity.
Well, as I said before, I think that this current opportunity with building a facility and possibly building something into it is possibly our only chance to do so. As far as Justice Point goes, it's really hard to hear, but my concern, you know, like I say, this clinic is not solely meth, of course, as the judge was discussing, but for lack of better words, I'm just using a meth clinic. But we do need something in the area so these people have some place to go to. Just like the other gentleman was speaking about people coming out of jail or whatever, but they need place to go to. Not just you know, a lot of these places are giving out pamphlets or, you know, discussing what they can do and stuff like that, but they need actual you know, nurses where they go to and get their medication and stuff like that in the local area.
Yes, I mean, having good quality clinical services and social services in general in the community is obviously ideal. So again, what Sawyer County decides to do with the building is certainly, you know, obviously something that would impact our programs. having programming close by or having additional clinical services, especially in our clients, is certainly going to improve outcomes.
Mr. Howard, just so you have a point of clarification, I don't know if you caught the first part of the meeting, but we're going to have on the agenda for next month, the Healing House, the proposal that's coming from the tribal members that are seeking support, both from the county and from the tribe. I think Mr. Hilgendorf, are you the one that's working with the men's housing? So there's a couple of different initiatives that we're starting to realize with this committee's efforts in terms of harnessing other alternatives for treatment, care, and other things outside the scope of what is understood to be the government's responsibility. So next meeting will be closer to what your question is, that I think actually addresses better than what the request is in terms of the construction space. Mr. Howard.
Thank you, thank you, Mr. Chair. That, you know, of course, I don't know everything. You know, I might say I do sometimes, but no, I'm kidding. But that really helps me out there. So I really appreciate that. Thank you, guys.
Mr. Sainer, you want to continue the rest of your update? Maybe introduce your staff?
Yeah, and I'm actually going to turn the floor over to DP Light, who will do her introduction and then introduce the team.
Hi, everyone. I'm Nikki Light. I'm the Director of Justice Programs for Justice Point's Western region, so Western Wisconsin and Minnesota. My home base is in Minneapolis, and I'm going to have Melissa and Becky introduce themselves, and then I'll go over an update for what we've implemented in the last month. So I'm Melissa. I was appearing by Zoom.
Raise your hand. You can see it. We don't know who's talking.
And I'm working as the program coordinator.
I'm Becky Berry. I'm the case manager.
So Becky and Melissa are both on site. Right now, we started implementation on January 16th, I think was the exact date. And we've been doing screenings and assessments in the jail. So both Becky and Melissa have been conducting those, compiling the results of the pretrial assessment, the UNCOPE, which measures for substance use disorder, and the K-10, which measures for mental health need for referral or further services. So that information is compiled and that's presented to Judge Yackel. Judge Yackel has been making decisions on release at that point and referring people back to Justice Point for people who are on pretrial supervision release. And then that caseload, which is at about 29 individuals right now. Yep. So those individuals are then supervised by Becky and Melissa, doing drug testing, court reminders so that they make appearances back in court, coming in and meeting with Becky and Melissa so that they can refer them to resources in the community or get an idea of what barriers are in place for them to make court appearances or for them to remain law-abiding while they're awaiting their court appearances. So we've had a meeting with Judge Yackel. We had a meeting with the district attorney to talk about implementing diversion programming, which Becky and Melissa are also screening, doing the LSIR SD, which is a screening tool for risk and needs. If those individuals are coming back as moderate to high risk and needs of services, Becky and Melissa are making them referrals if those people would be appropriate for a diversion program. We talked to the judge about kind of using the diversion program as a catalyst for, you know, a pseudo drug court, that we can start to offer services and get individuals who are facing drug charges into the diversion program. And then as capacity builds and resources become available, that we can make that a more robust program. We're meeting with Lieutenant Johnson this afternoon to talk about jail programming and electronic monitoring. And we met with the Tribal Governance Board this morning to talk about coordination of resources. And in a couple weeks, we have a meeting with the LCO clinic to talk about how we can share referral information, make sure that people are able to access resources on the tribe that are referred for pretrial supervision or for diversion. So, anything you guys want to add?
Is there any questions from the committee for Justice Point? Is there anybody online that's got any questions? One question I have is for tribal members who are on either kind of the bond testing or whatever, are we making arrangements for them at Vijiki to get tested down there, or is that, what's the process that we're contemplating for that?
I think we need some more conversations. We were directed to start with the LCO clinic from the tribe, as to start those conversations about how we access services.
That's why I got
how
all
we
the
do
dead
drug
stairs,
testing.
huh?
So we're definitely starting to talk about those things. And
But that's contemplated, right? Is that a doable thing? Because we had that before.
Yes, yeah.
And we want to make sure that that's, because there's a lot of different unintended benefits that come from that.
Kathy McCoy has her hand up.
Ms. McCoy. Kathy, can you hear us? She unmuted? Can you unmute her?
Let's see if we can.
Kathy,
Okay. Yes, I just wondered if you are coordinating with Health and Human Services in any ways with any of your programming and the mental health department over there and the staff over there to bring them into the picture along with LCO and the other entities?
Yeah. We haven't set up any meetings yet, but they're definitely on our list of stakeholders that we need to reach out with and be coordinating with.
Okay, thank you.
Yeah.
So my other question then is, who gets to come to the monthly meetings? Who's going to be coming? You two?
Probably be me
You?
primarily.
Okay. So we got to make sure that we have your contact information with Ms. Fitch.
Did you see my last?
Yeah, I did. And I didn't know that.
I guess my only comment, this is Judge Yackel, is that we've had the discussion with Nick and with Becky and Melissa regarding what a drug court looks like under our present situation, and I think we've got a pretty good roadmap as to get that up and running. I guess my position has always been is once the county board follows through and we know that we're going to be getting this addition and we're going to be getting these additional resources from the state. I mean, it's a kind of a condition precedent. They got to build it, and then we get more resources from the state. I think number one topic is to start outlining this drug court, getting it in place for all of the funding and thing. I think that's the number one thing. So that is, at least on my agenda, is something that is going to be number one tops. I mean, it's a question right now of utilizing the resources that we have as efficiently as we possibly can. What changes after Thursday, hopefully, will be that we know that we're getting additional resources, so we're going to be preparing that. So we can maybe take additional risks with the resources that we have, knowing that more is coming. So I guess that's my viewpoint of how we're going to be looking at this drug court. And Tom, I know that that's really important for you in the county and getting this funding. So that's, I guess, just where I'm at on that.
All right, I'm going to start wrapping things up. Mr. Hoff, do you have any questions regarding Justice Point?
No, none here.
Mr. Coy, do you have any questions for Justice Point?
No, I just would encourage that. I think Health and Human Service and their department needs to be included in the process, because they're right there in the courthouse in Sawyer County, and there are resources there and they should be utilized.
Mr. Hellwig, do you have any questions or any last comments? All right, I've been remiss. Mr. Channing.
No, I don't think I have anything. I just wanted to say, I do have some. I just want to say thank you for Kathy's comment, because Health and Human Services goes right along with what I was bringing up earlier. That's all I have. I'm on the road, so thank you very much, guys, everybody.
All right, before we close this out, I have one comment from James that we're going to get to in a little bit. Mr. Channing, I overlooked you when we had the courtroom discussion. Is there anything that you wish to address the committee, or any of the comments that you wish to add?
Nope, I just think with having Justice Point and starting to get a roadmap for a drug court, that's the other additional aspect that I know the director will be looking at when awarding the second judge to Sawyer County. So it's good to see that we've got some positive progress along that road. And after Thursday, we'll see where we stand with the facilities.
James, I'm going to give you some time here to address Justice Point. Do you have any questions that are relevant to discussion that we have going forward?
Yeah, I was just in reference to Justice Point here, speaking of the mental health and then programming. And I had brought up the, programming in my apartment, I'm going to also the belief in Christianity, and human interface argument within the two. So if you're defining rehabilitation within the manner of human interface, you manipulate the natural body, I would be against those of you who support that. Because I don't believe that the stability of, say, myself, for instance, to make an example, I'm a released inmate or what, convicted felon, but I've been released from state custody. I don't believe there's any need for human interface. To be honest with you, I would never allow you to do it if you had or anyone else.
James, I'm going to have to
I just want to say, I just please let me say this because I think that.
James, I'm going to restrict what you have because I need your questioning to be relevant to what Justice Point's presentation is to this.
I mean, what's the diversion? Like, how do you influence me as a citizen to divert my thoughts? Can you define that?
All right, your comment is recorded for the record, and I'm concluding the presentation from Justice Point. We're moving on now to number 9, the date for the next meeting. I need committee members to bust up their calendars. Understand that I'm adding or directing the clerk to add Healing House, the LCO initiative to the agenda for next month. And then Justice Point, you're going to be a standing item on that. So your name again?
Melissa.
Melissa will be coming in. Mr. Hilgendorf, anything you wish to add to the agenda?
No, we're gonna be opening in March though, across the street.
We should probably put that on there because I think that's a really good discussion. I think Mr. Howard probably would benefit from that. So what are we looking for next month's meeting dates? All right, we're going to start with days that end in Y. I got court. About what we want to do before the.
There you go. Pick a day.
14th of March, the noon, Sunday. March 14th, March 17th. Wednesday?
Yeah, that'd be good.
St. Patrick's Day? I don't know if it's a federal holiday, but. Sprocket, how do you feel about Wednesdays at noon?
Sounds great.
Sure. Ms. McCoy?
Yes, and it is official holiday.
Well, then you can wear green.
I will. And a shamrock.
So we're going to set the next meeting for Wednesday, March 17th at noon. And if there's nothing else, this meeting is adjourned. Thank you, everybody.